Good morning, everybody. Myself is Professor Dr.Deshpande. We are in the Ayurved College, Nigdi, Pradhikaran, Pune 44. With me are the students of post-graduation, that means the students who are doing the MD in Ayurved. And today's date is 25th of July 2018 and the day is Wednesday. Today's topic will be Ayurvedic management of bronchial asthma, part 1, because this topic is very vast and so we can study it for 1 or 2 or 3 lectures. So Ayurvedic management of bronchial asthma, so naturally our focus will be on the Ayurvedic physiology, Ayurvedic pathology, Ayurvedic pathophysiology and Ayurvedic philosophy or the concept. So there will be different terms like Dosha, Dhatu, Mala, etc. We will study them step by step. First, let me clear that this particular bronchial asthma can be compared with the Tamaka Schwas concept of Ayurveda. Ayurveda has described the Schwas Vyadhi, and Schwas is not really sense is a Vyadhi which is described by Charak. But what he has described is a symptom, that is breathlessness. Schwas is a symptom, breathlessness or dyspnea. So this breathlessness, dyspnea can occur with many types of the diseases or in many diseases. So one of the diseases which is mentioned in Ayurveda is a Tamaka Schwas, which can be compared with bronchial asthma. What is bronchial asthma? This is a chronic tendency of bronchial spasm. Chronic tendency of bronchial spasm. So your primary, secondary, tertiary, these bronchi, they get automatically spasm. What is meant by spasm? It is a contraction, severe contraction. Abrupt contraction is called as a spasm. This is when there is a spasm, naturally you cannot expire physiologically, normally. So there is definitely some obstruction. So this is expiratory airway obstruction. Bronchial asthma is a expiratory airway obstruction. According to Ayurveda, this can be called as a Srotorodha. Ayurveda gives the concept of Srotas. Srotas means micro and macro channels. Micro as well as macro channels. So trachea, bronchi, esophagus, all these can be Srotas. But at the same time, when we talk about cell membrane, there are lot of porosities. So that all pores around the cover, cell membrane, they are also included as a Srotas. These are the micro Srotas. So we must understand this concept because that can help you for further understanding of pathophysiology. Bronchial asthma is mainly connected with 2 things. First, according to Ayurveda, is a bija dushti, Tamaka Schwas or bronchial asthma has a basic cause in many people as a bija dushti, which can be compared with a hereditary problem. Hereditary tendency, you can say. So whenever any Tamaka Schwas or bronchial asthma patients come to your clinic, it is your first duty to take the proper family history. Proper family history is most important with connection to the bronchial asthma or the Tamaka Schwas. Either his father, mother, uncle, paternal uncle, maternal uncle, brother, sister, they may have asthma or is more important, allergic skin problems. You should not ask only about the asthma. You can ask about allergic skin problems. So, in any bronchial asthma patient, you must have a proper family history record where you can ask about father, mother, grandfather, uncle, brother, sister, etc. regarding asthma and regarding allergic skin problems like eczema or the tinea Tinea is not actually the allergic problem, but majority contact dermatitis, you can say. Contact dermatitis is a common example of the allergic skin rash. Then, second factor regarding the bronchial asthma, after the bija Dushti or hereditary, mostly bronchial asthma is related with the allergic type of the provocating factors. So, allergic asthma is very, very, very common. You must remember that. So, you must inquire whether the patient is having allergy about any damp substances. It may be the food substances, it may be the cosmetic substances. So, you must have some list of the possible allergens. List of possible allergens, and you can ask as a checklist, this, make a tick mark. For example, there can be dust allergy. Marathi मध्ये धुळीची allergy. Dust allergy is very common. Fumes, different types of the fumes. Aroma, scents, any odor, specific typical odor. Pollen grains, especially German people are very sensitive for pollen or the spring allergy. Peanuts, now about food stuff. Shengdane, peanuts. Cashew nut, kaju. Fish, egg, brinjal, tomato, animal fur, that is very important. Some people, they always ask in history whether you have any domestic animal like the cat or the dog. They have the allergy of these domestic animals' fur. Exposure to the cold. Exposure to the cold. Whether you call it as allergy or not, that is a different issue. But some people get immediate attack after they exposed to the cold. Cloudy weather. Cloudy weather. And last but not least, mental stress. Of course, mental stress is not allergen. But I am saying the cause of the bronchial asthma. So first is a hereditary, second is allergic, and third is a mental. So these are something the commonest causes for getting the bronchial asthma problem. Now, in Ayurvedic language, there are two specific terms, Sroto Vaigunya and Sroto Dushti. Sroto Vaigunya and Sroto Dushti. Sroto Vaigunya means weakness of your particular organ. For example, here we are talking about bronchial asthma, so your respiratory tract is weak. Respiratory tract has a weak immunity, and that is why, because of the immunity, there may be some structural problems as well, and there may be weakness problem as well. I can give you some examples how this weakness can arise. Smoking is one of the important reasons to cause the weaker immunity of the respiratory tract. Your tobacco, your smoke, carbon monoxide damages your all the mucus layers, and that they become dry and the spasm starts. So smoking is one of the important. Then living or working in the air polluted area. Nowadays air pollution is very, very common. For example, day and night, the police people, road traffic, they always stand in the crowd, in the vehicles. So lot of pollution is there, and they are more exposed to the respiratory tract problems. The police people, remember these things. Then the people or the workers who are working in the factories, different factories where the chemicals are burned and the fumes are coming. Chemical factories, paint industry, glass industry, all asbestos industry. So all these industries are making your respiratory tract more and more weak. Even all the time working in the air conditioning, especially cold, more cool, not the normal, more cooling effect. That is also the troublesome. Chronic sinusitis, this is one of the disease. So you must ask these diseases, whether you are repeatedly rhinitis, sinusitis, upper respiratory tract infections. Repeated infection can also make you weak. All the time bacterial infection is there on and off. That can make your respiratory tract more weak and you are susceptible for getting the attack of bronchial asthma. In Ayurveda, the word, Sanskrit word is Purvotpanna Vyadhi. Purvotpanna Vyadhi means history of previous diseases. History of previous diseases is much more important. You must ask this history. So that can cause the Srotovaigunya. And then one day, whenever some allergic exposure is there, or the cloudy weather is there, cold weather is there, immediately there is a Vata Prakop. Vata Prakop. So Vata Prakop can cause the attack of asthma, which is called as a Dushti. That is Vegavastha in Ayurveda. Vega Avastha. In Vata diseases, there is always the terms Vega and Avega. Vegavastha and Avegavastha. In modern medicine, they are called as a exacerbation and remission. So bronchial asthmatic patients can get an attack for few days, and at some days, some months, they are totally free of any problem. They don't have any cough, they don't have any breathlessness. They are absolutely normal like other people. And one day suddenly they start the attack. So Srotovaigunya is different and Srotodushti is different. Vegavastha and Avegavastha. How you describe the bronchial asthma in Ayurvedic terminology? How you can describe this concept? Bronchial asthma is a disease of Vata Prakop. Bronchial asthma is a disease of Vata Prakop or Vata vitiation in Kapha organ. Try to understand the two terms. Vata Prakop in Kapha organ. And both are having some properties same, especially Shita Guna, cold nature is of Vata, cold nature of Kapha. So naturally is addition 1 plus 1. So there will be havoc when there is a cold exposure. So Vata Prakop, Vata vitiation in Kapha organ, that is respiratory organ. This is a description according to Ayurveda about bronchial asthma. Next, when we say is a Vata Prakop, let me clear once again, in every lecture I clarified this fact because listeners may be different. When some people are hearing my audio, the people may be different. So Vata is a bioenergy responsible for all sorts of movements or the activities. And these activities are gross activities. Like for example, I am speaking, that is because of Vata. We are walking, that is because of Vata. We are moving our hands, that is because of the Vata dosh. My heart is pumping because of Vata dosh. My respiration is going on, inspiration, expiration, that is because of Vata dosh. In intestine, my peristalsis movements are there, that is because of the Vata dosh. So micro and macro, gross and subtle. What is meant by subtle? Nerve conduction. We cannot see the nerve conduction grossly. I am just moving the hand, but there is nerve conduction. Neuromuscular junction. Acetylcholine is there. Acetylcholine is coming from pre-neuron. It is poured into the synapses and it is again going to the post-neuron. So these are the steps, these are the movements of neurotransmitter. These are also because of the Vata dosh according to Ayurveda. In UG level we just understand the gross movements. But you must remember subtle movements are also meant by the Vata dosh. Chemical movements, physical movements, neurological movements, conduction, everything is under control of Vata dosh. Ayurveda has given the main 5 types of the Vata dosh, taking care of 5 important movements. In respiratory tract, there is a Prana Vayu and Udana Vayu. So Prana Vayu is responsible for inspiration, Udana Vayu is responsible for expiration. So all the intercostal nerves, action of the phrenic nerves, they are nothing but the Prana Vayu. Remember, they are making the contraction of diaphragm. According to the modern science, physiology, phrenic nerve, that is Vata dosh, Prana Vayu, according to Ayurveda. And Udana Vayu is helping to relax. Because inspiration is active process, and when the contraction is released, that is released is also there. Movement is there. That is under control of Udana Vayu. Expiration, relaxation. Contraction, Prana Vayu. Relaxation, Udana Vayu. So this relaxation can be obstructed by the another situation. For example, Ayurveda believes that there is a Samana Vayu which is taking care of your intestinal tract or the digestive tract. So Vata dosh, who is controlling the movements of my stomach, movements of my intestine, if that nerve control is disturbed and there is no peristaltic movements, stop, then that can hamper the movement of my diaphragm. And that is why Ayurveda says that all Vayus are interlinked, interconnected. So Saman Vayu is not functioning, but because of that my Prana and Udan gets problem. Try to understand. My Saman Vayu is not functioning properly. Problem is in my stomach, but it is affecting my respiration. Now the urination, defecation, that is under control of Apana Vayu according to Ayurveda. But if that process is hampered and I have the full bladder, for example, I have the severe constipation, then that can give the back pressure on the diaphragm, and again my Prana and Udan Vayu will be suffered. So because of the problem in Samana Vayu, because of the problem in the Apana Vayu, they can affect your upper respiratory tract problems. Is it clear? So Prana and Udana are mainly responsible, talking about the bronchial asthma. Prana Vayu is inspiration, Udana Vayu is expiration. And normal movements are called as Anuloma Gati in Ayurveda. Some terms are very important. Proper conduction, physiological conduction, physiological movements are called as Anuloma Gati. It is not only peristalsis, remember my words. It is not only, for example, take another example of heart. Inferior vena cava, superior vena cava, pouring the blood in the right atrium. Am I right? Impure blood is coming. Right atrium to right ventricle. Am I right? Right ventricle to pulmonary artery to the lungs. If my lungs is full, COPD is there, then can prevent my blood from going right ventricle into the lung. So this is also Anuloma Gati. Try to understand. So cor pulmonale is a disease of Pratiloma Gati. This is something new for you. UG, you understand only here. Stomach, Anulom, finish. Intestine, Anulom. But they don't think when your EEG is disturbed, electroencephalogram, alpha, beta, theta, delta waves. If they are disturbed, that is also Pratiloma Gati. Try to understand. So generally you must remember, proper physiological movement is Anuloma Gati. Any pathological movement of nerve, of muscle, of bone, of chemical, of hormone, so many words I am using. Any abnormal movement is Pratiloma Gati according to Ayurveda. And why I am explaining you? In every place you have to give Vatanuloman Chikitsa. Is it clear? This concept is very important. Further, we are talking about bronchial asthma and we say allergy is the main cause. But Ayurveda don't believe on this concept. Ayurveda says bacteria is not faulty. Viruses are not faulty. Fungi are not faulty. They are not guilty, I can say. Te gunegar nahi hai in Marathi. Te gunegar nahi, they are not guilty. You are the person who is a defaulter. Try to understand, very different concept. Allergy. So allergens are not the victims. Te gunegar nahi hai. Allergens are not victims. You, the person, patient, is a defaulter. Why? Because Ayurveda believes that external environment and you, there is always a type of battle. So when you are healthy, that means your power is strong. Because bacteria are there, viruses are there, all the time, everywhere. Allergens are there. But some people, they get the problem. Some people, they get the disease and others don't get. What is the reason? That is the immunity according to modern science. And we have the same concept. We say our Vyadhikshamatva is most important factor for any damn disease. Any disease. It may be cold, simple cold. It may be bronchitis, it may be pneumonia. It may be food poisoning. It may be diarrhea. It may be urinary tract infection. So the person is guilty because he has not maintained his diet and lifestyle. That's why his immunity is low. This is the most important principle of Ayurveda. Don't forget it. In bronchial asthma also, why you suffer from allergy? Because the patient's immunity is low. Is it clear, the first thing? So your target should be why his immunity is low. Allergy is a secondary. So if you do hundreds of tests of allergens, something new will come and that can cause the allergy. There is no rule how many allergens should be there. In the environment, there are n number of allergens. By the joke, I can say, even the human relation, they have the allergic relations. Some people, they cannot communicate with each other because they have the allergy of the another person. This is something like joke, but it's a fact. Communication is because you cannot maintain because of the allergy. You cannot understand your wavelengths are not matching. Similarly, over here, the allergens is not a problem, but your body's immunity is the most problem. So it's very simple to understand why your immunity is low. Ayurveda has given the reason. Rogaha sarve api mandegnau. For bronchial asthma, this is very, very true. Rogaha sarve api mandegnau. Manda Agni is a concept. Weak digestive fire is the main problem in bronchial asthma. Weak digestive fire. This is a part of curiosity. You must go in a detail while discussing with the patient. You must find out why his digestion is hampered. And whenever you talk about Agni, whenever you talk about the metabolism, don't consider only stomach and intestine. Always think of all the 7 tissues. Rasa, Rakta, Mamsa, Med, Asti, Majja and Shukra. Because fire is, central fire is Jatragni. But 7 fires are there in the body. Dhatvagni, tissue fire. Tissue metabolism is equally important. If you find that his appetite is good, his stools are good, but it is not that his muscles are good, his bones are good. No, there may be some problem. So we have to test both the things, central fire as well as the tissue fire. But many times it is said that when your central fire is good, tissue fire probably may be good. There are chances of 70, passing chances are there. Central fire good, Dhatvagnis are good. But central fire is problem, there must be problem. So immunity is depend on the Agni concept. Now, bronchial asthma, if you read the pathophysiology in the textbook like Charaka Samhita, origin of disease is mentioned as GI tract. Bronchial asthma is originated in a GI tract, and this is something looking to be funny to the allopathic doctors. If you make a discussion with the chest specialist, they will not agree with this concept. They will say, what is the relation of your esophagus, stomach, intestine and your lungs? 2 separate parts are there, but then they are correct in their respect because they don't have understood our Ayurvedic physiological concept. There is no structural relation, try to understand. There is no structural relation, but there is a reflex relation. Try to understand. Very important, I am saying very important. You can give the chest physician my one example. One example I am giving you about the cough, COUGH, their cough. They have the different reasons. Pharyngitis, laryngitis, tonsillitis, bronchitis, pneumonia, different causes. But then they have last. Another cause is, that is called as a reflex cough. You go to the medicine book and see my statement. They have mentioned reflex cough. If the child has worms, he may have the cough. Now ask him what is the relation. Ask him what is the relation. You people, incentivists, ask them what is the relation. Why they call it the reflex cough? Then they give example of vagus nerve, etc. But you must ask them. Second, you go first read your medicine book and then ask to your chest physician. More, you must ask him. Another reason, otitis media. Remember my word, otitis media is mentioned in the medicine book. It can cause reflex cough. It can cause otitis media, you know the disease. Tympanic membrane is perforated, pus is coming, mucus is coming. It can cause cough. Now, how here we can make a connection? What I mean to say, there are many things that can be interlinked with a different aspect. So Ayurveda has its own aspect that bronchial asthma is originated with the disturbance in Kledak Kapha. Now their cough spelling is modern medicine is COUGH, and where Ayurved we are mentioning cough KAPHA, kapha. Don't get confused, my dear listeners. COUGH, modern cough, phlegm, expectoration. But Ayurvedic cough is a bioenergy. This cough in the GI tract is responsible for proper coordination of Vata Pitta Kapha. There is a Pachaka Pitta according to Ayurveda in our GI tract. Samana Vayu is there and Kledak Kapha is there. Ayurveda says each and every our physiology is nothing but homeostasis in between or amongst Vata, Pitta, Kapha. They go hand in hand. They work together. If any of these element is damaged, your physiology is damaged. Is it clear? You take a blood circulation, you take respiration, you take digestion, you take urine formation. Everywhere you will find Vata is there, Pitta is there, Kapha is there. They may be of different names, but in digestive tract, GI tract, Samana Vayu, Pachaka Pitta and Kledak Kapha. These must be in coordination. And here is the problem. Kledak Kapha is because of your faulty eating habits. You are not eating properly. So there is a burden. You are giving him poisons. You are giving him, the toxins. You will say, how funny you are talking. Which poison I am eating? Try to understand very simple thing. Because the listener, if he is a non-Ayurvedic, he will get confused. Deshpande is saying, we are taking poison. Can you say how it is poisoning? Now, for example, your vegetables, if you are not properly washing or cooking properly, they are all burdened with pesticides and insecticides. And nowadays, researches are going on in America that because of the chemical fertilizers, chemical pesticides, chemical insecticides, they can cause cancer. Now, is it not a poison if it is causing the cancer? And that's why I am saying, even my regular eating lunch time is at 12 o'clock. If I eat 12 o'clock, there will be hydrochloric acid secretion, normal, physiological. Circadian rhythm. You know this word, circadian rhythm. Biological clock. These are famous terms, biological clock. So at some time, some hormones are secreted. Some enzymes are secreted at that time. They have their own duties. So your pepsinogen, pepsin, hydrochloric acid, trypsin, chymotrypsin, erepsin, all will be secreted in between 12 to 2. Best. Is it that means at 4 o'clock they will not be there? They will be there. But they will not be of that quality. They will not be of that quality, 100% sure. And that's why they cannot digest properly your food. And when the food is not digested properly, according to Ayurveda, it is like a poison. It is like a toxin. Improperly digested food is poison according to Ayurveda, which is called as a ama. Which is called as ama. Improperly digested food. Not only central digestion. For example, if there is a Mansagni sadhana, that means Mansagni is weak. So whatever you will eat, they will not be converted into the muscle tissue. One of the famous example, the young people are going to the gym nowadays. They want their body to be very strong. Body building, muscle building. They are doing weights. You heard the word weights. And their gym instructor, they ask him to take lot of eggs. Eat lot of eggs. Because it is high protein and your muscles will require protein. I have seen some patients in my private practice. That the young chap came to me, what was his complaint? Doctor, I am getting a little bit more eructations and a lot of flatus and it's little bit foul smelling. My muscles are okay, but I am feeling little bit irritable or heaviness in the body. So I asked him and he gave me this history that his gym instructor asked him to take minimum 10 eggs per day. Now he is not able to digest those 10 eggs. So what is the hell he is eating? That is, he is eating poison. Here comes the importance of tissue fire, that is Mansagni according to Ayurveda. Coming back to the point, bronchial asthma is a primarily problem in the central fire because your Kledak cough is not properly acting. It is originally weak and you are making him more and more weak because of your faulty eating habits. Is it clear? Second thing, this central cough is controlling the other cough. Central cough is controlling the other cough, main cough sites in the body. So there are 5 important kapha types mentioned in Ayurveda. Central is a Kledak cough in the GI tract. Bodhaka kapha with your saliva or upper GI tract. All the serous mucus secretions can be considered as a bodhak kapha. Basically it is related with the secretions in the saliva. That is a bodhak kapha. Then there is a avalambak kapha, which are the secretions in relation with the respiratory system and cardiovascular system. All lubricating material. I am not restricting only for the pleural fluid. Yes, it is avalambaka, pleural fluid. Pericardial fluid, okay, that is also avalambaka. But I say, even the mucus glands present in the bronchi, they can be considered as a part of avalambak cough, which is not given in any book. Do you understand? Any secretions which are helping for lubrication and for nutrition, because cough is for nutrition and maintenance. So anything in the heart region, in the lung region, in the bronchial region, wherever there are some mucus secretions, serous secretions, or the nutritive material is secreting, that is all coming under the avalambak cough. This is my concept. Then, so Kledak central, bodhak is there, saliva, avalambak is there in the chest region. What else? Tarpaka kapha. So tarpak cough, primarily everybody knows it is compared with the cerebrospinal fluid. But again I will repeat, not only cerebrospinal fluid, it is the main thing, but any secretion which is a nutritive type can be considered as a tarpak cough. We have to find it out, the names for that. But any secretory, lubricating, protecting, nutritive, whatever may be there in the brain region, in the nervous system, that can be considered as a part of, remember my words, part of tarpaka kapha. Why not? Why not? Even in that say, I can say even myelin sheath. Myelin sheath. Do you understand? It is formed by phospholipid. Do you understand this phospholipid? So what is the word lipid? Lipid is a snigdha padartha. Snigdha element. Kapha is a snigdha element. When There is a demyelination, nerves are going. You know the diseases. What is motor neuron disease? That is myelin sheath is damaged. Nerves are exposed and Vata Prakop is there. Kapha Kshaya, Vata Prakop is there. So, I think this is the first time that I am telling you try to understand the broad concepts of Ayurveda. Till usually we have restricted cerebrospinal fluid, that's it, Tarpaka Kapha. No, everything. You have to go read physiology, go read medicine and find out, discuss with the modern doctors. Whatever nutritive material is there, whatever protective material is there in the brain, that is coming under the Ayurvedic concept of Tarpaka Kapha. And last is a Shleshaka Kapha. Shleshaka. Till today, we know only synovial fluid. Synovial fluid is equal to Shleshaka Kapha. But again remember, I am saying not only synovial fluid, anything which is nutritive material around any joint, not only knee joint, interphalangeal joints, metacarpophalangeal joints, whatever you find out which is material there, which is a protective, which is a nutritive, which is a lubricating, will be under control of Shleshaka Kapha. And there is always balance in the body of Vata and Kapha. Vata is for movement, Kapha is for stability. Vata for movement, Kapha for stability. Both is important, remember. Day is important and night is important. We are working in the daytime and we are sleeping at the night time. Both is important. So Vata movements are important, Kapha stability is also important. So whenever there is excessive anything, for example, if there is a lot of activities and you don't have the protection from Kapha, there will be Vata Prakop. If there is a lot of Kapha and obstruction, Vata movements cannot take place. So there should be homeostasis or balance in between Vata and Kapha dosha. Both are necessary for the body. Both are necessary. That is very important. They are really having something like opposite action. Like our, again for a joke matter, you can say our marriage concept. So whenever the partners are balancing with each other, that is better, I think so. Some is more enthusiastic and some is little bit slow, that is better. If both are slow, that is problematic. If both are hyperactive, that is also problematic. So husband and wife are like Vata and Kapha. Both are important. Husband is important, wife is important, but they have some good homeostasis, intercorrelation. So this is some very interesting concept of Ayurveda. So origin of the disease is Kledak Kapha Dushti, that is Agni Mandya, weak digestion, weak metabolism, but manifestation of disease, another medicine word, manifestation, origin of the disease in stomach. According to Ayurved, remember these words, according to Ayurved, origin in stomach, amashaya, manifestation, urasthana, chest region, respiratory system. And what is the pathology? So bronchial asthma, origin of the disease in GI tract, Kledak Kapha Dushti, Agnimandi is there, Amasha is the organ, manifestation is the chest, Urak Pradesha, respiratory system. What is the pathology? According to Ayurveda, Samprapti word is there, Samprapti. Pathogenesis, that is can be compared with the Samprapti. Kapha obstructs Vata. Kapha dosha obstructs Vata dosha in Prana Vaha Srotas. Prana Vaha Srotas is a concept of Ayurveda, can be compared with the respiratory system. But respiratory system is only a part of Prana Vaha Srotas. Try to understand the difference. You cannot always say Prana Vaha Srotas is equal to respiratory system. No. Prana Vaha Srotas is a part, or respiratory system is a part of Prana Vaha Srotas. So Kapha obstructs Vata in Pranava Srotas at subtle and gross level. Sukshma and Sthula, subtle means micro channels, as I have told you, and also the macro channel. So obstructing at cellular level and obstructing at a structural. Large bronchi is obstructed because of the bronchospasm. But are you understanding there are muscles to get the spasm? No? And muscle tissue has the cells. Do you understand? So that arm reaches to that level, muscle cellular level, and then it gets the spasm. This is something new that you are hearing, and that is why the importance of arm concept. Second pathogenesis point or the Samprapti point, because of the obstruction there is a disturbance in prana and udana anuloma gati. So inspiration and expiration, these movements are disturbed. Now next sentence about pathogenesis, third point or the fourth point. There is a spasm of bronchi. Spasm of bronchi means Srotas Sanga. Sanga is a specific term in Ayurveda. Sroto Sanga. For my Ayurvedic students who are listening this my audio lecture, Sroto Dushtichi Samanya Lakshane. Do you remember the clinical features by Sroto Dushti? They are mentioned by Charak. Ati pravrutti, sango va, siranam granthayopi va, vi marga gamanam chapi, srotasam dushti lakshanam. If you don't remember right now, forget about it. But there are different types of the Sroto Dushti. Ati pravrutti, excessive action. Sanga is obstruction. Now, this bronchial asthma is a main spasm. So, there is a Sroto Sanga. Then, because of the Sroto Sanga, Vata becomes Pratilom. Vata Gati, movement of Vata Dosha, becomes abnormal. Pratiloma means not normal, abnormal. Pratiloma, abnormal. And that is why there is expiratory wheeze. Because of the Pratiloma Gati, there is a expiratory wheezing sound or whistling sound. Do you understand? This is not normal sound. Or normal respiratory sounds are called as, do you know the word? Vesicular in the lung parenchyma and bronchial in the trachea. Only two are the Anuloma Gati. When there are vesicular and bronchial, Anuloma Gati. But whenever there is a whistling sound, wheezing sound, that is Pratiloma Gati of Vata Dosha. Is it clear? Now, treatment policy. What can be done? Treatment policy. As we are seeing, first there is a Rogaha Sarve Api Mandegno. Kledak Kapha Dushti, digestion problem, central digestion problem, tissue metabolism problem. So, first step, Agni Deepan. Ayurveda says, in bronchial asthmatic patients, you must first try to rectify his digestion and metabolism. The word is Agni Deepan. He should have the very nice appetite. He should have the very normal stools every day. His defecation, absolutely normal. His urination, absolutely normal. There should not be gas in the stomach. There should not be pain in the stomach. There should not be heaviness in the stomach. If these are all the symptoms, he is very, very hungry, then you can say, yes, Agni is good. In bronchial asthma, you must take all these symptoms. Appetite, stools and abdominal symptoms. Must. If there are problem, correct it, and then give the bronchodilators, then give the inhaler. First you check Agni Deepan. Second, Vatanuloman. Try to relieve the bronchospasm and make the prana and udana gati normal. No whistling sound, no wheezing sound. Then your treatment is good. Vatanuloman. Bronchodilators is a Vatanuloman. Not only bronchodilators, antispasmodic for the stomach. Triphala, Ayurvedic Triphala tablet. Vatanuloman. Then, to improve the immune capacity, because Sroto Vaigunya, we want to relieve the Sroto Vaigunya, to improve the immunity of the Pranava Srotas, you give the Balya and Rasayana. Balya and Rasayana for Pranava Srotas. Balya, Rasayana is rejuvenating, immunomodulating treatment for Pranava Srotas or respiratory system. If anybody researcher is interested to check where I can get this type of the medicines, where I can get this type of the treatments, which chapters or which topics he should search in Charaka Samhita, Sushruta Samhita, Ashtanga Hridaya Samhita. These are the original compendia, Samhitas, reference books of Ayurveda. Which topics you should see? Number 1, Schwas Chikitsa. You read this topic, Schwas Chikitsa, from all Bruhatatrayi and Laghutrayi. Second topic, Kasa Chikitsa. Kas in English, COUGH, cough. Cough treatment, cough management in Ayurvedic text. Kasa Chikitsa, number 2. Number 3, Amashaya Gata Vata Chikitsa. Amashaya Gata Vata Chikitsa, because origin is in the Amashaya, Kledak cough. So you go search for Amashaya Gata Chikitsa, Amashaya Gata Vata. Fourth one, Agni Mandya chapter, Agni Mandya Chikitsa. Agni Mandya Chikitsa. There also you will get some medicines to treat bronchial asthma. So whenever you want to treat bronchial asthma, in our original text, Charaka Sushruta Vagbhata, Yoga Ratnakar, Madhav Nidan, Bhav Prakash, you must go for Schwasa Chikitsa, Kasa Chikitsa, Amashegata Vata Chikitsa and Agni Mandya Chikitsa. Next, clinical features in bronchial asthma. When the patient comes to you, what are the signs or symptoms? Especially symptoms. First symptom will be dyspnea, breathlessness. He cannot breathe properly. Bronchial asthma patient cannot breathe properly. Cough, little or moderate. There is not too much cough. Many patients, they have the very little cough. Sticky cough is there. Very little cough is there. Then sweating will be there. Sweating. Mentally anxious. Patient will be little bit afraid, anxious. Now what will be happen? I am getting problem, I cannot breathe. Please treat me. So anxiousness is there. On examination, next part is on examination. 2 or 3 things can be observed. Number 1, by inspection you can see there is accessory muscles are working. Patient's chest and neck accessory muscles, sternocleidomastoid, ali nasi, this one, there is a excessive hyperventilation and the accessory muscles are acting. By inspection, by look. Then second, he may have, if it is a chronic case, pigeon chest. His antero-posterior diameter will be more than horizontal dimension. Antero-posterior, it's like a pigeon chest. So it is called as a pigeon chest. Then when doctor is ausculting, he will get the expiratory wheeze at some places, a specific bronchi, expiratory wheeze, wheezing sound, whistling sound. Sometimes this sound is such a loud noise, without stethoscope also you can hear whistling sound. When the patient is very, very asthmatic, serious, emergency, then you can hear the whistling sound from a long distance also. Next we will talk about investigations. What you can do, investigations. Number one, simple test like hemogram. Especially hemoglobin is important. Of course, hemoglobin is not diagnostic for asthma, remember. But what I mean, if the patient is anemic, that can worsen the situation. So if you want to treat the bronchial asthma, your baseline should be proper. Baseline physiology should be there. So hemoglobin should be normal while treating the bronchial asthma. Number two, ESR, erythrocyte sedimentation rate. In any chronic illness, it is usually raised, but it is not mandatory. In any asthmatic patient, you may not get the raised ESR, but yes, if it is little bit accompanied by another disease like tuberculosis, if he is having arthritis, rheumatoid arthritis and asthma, then definitely ESR will be raised. Next will be absolute eosinophil count, AEC, absolute eosinophil count. That can be raised if it is a really allergic type of origin. If asthma has started after your allergic bronchitis, then absolute eosinophil count will be raised. Then you can examine the stool examination just to check for worms, because worms are the allergens. These are all supportive investigations. Don't try to understand. These are not main diagnostic investigation for bronchial asthma. Remember my words. Rather, my statement is very bold. Bronchial asthma is 90% clinical diagnosis. Remember my words. Bronchial asthma is clinical diagnosis by wheezing or pigeon chest. Very rarely you can find out any lab test or in a radiological test. Previously in our time only X-ray was done. But rather X-ray was not done to diagnose the bronchial asthma. Then for what? Then why we are doing the radiology? Just to pay him for 100 rupees? Why were we used to do the X-ray test? Bronchial asthma can be called as a diagnosis of exclusion. Very important term in modern medicine. Very important. Physicians know these terms. What is that? Diagnosis of exclusion. That means in my X-ray, I check there is no tuberculosis. So dyspnea is not because of the tuberculosis. Then there is no tumor. So my breathless patient is not having breathlessness because of the tumor. He don't have chronic bronchitis. So my breathlessness, patient's breathlessness is not because of the chronic bronchitis. So I can diagnose tuberculosis, lung cancer, mediastinal tumor, pleurisy, bronchiectasis, emphysema. All these things will come in X-ray. And when my X-ray chest POV normal, I can say no TB, no emphysema, no bronchiectasis, no tumor. So it may be, what is that? Bronchial asthma. That's why it is called as a diagnosis of exclusion. Is it clear? Next, LFT. This is the most nowadays popular diagnostic test which is supporting your clinical diagnosis of bronchial asthma. Lung function test or pulmonary function test are mandatory nowadays. Remember my words, are mandatory to confirm your clinical diagnosis of bronchial asthma. You must perform pulmonary function test. And in that also, at GP level, for the patient's level, it is PFR, peak flow rate, PEAK, peak flow rate, and it is done by peak flow meter. Peak flow meter is very handy, portable instrument for my asthmatic patient, just like glucometer to my diabetic patient. I advise my diabetic patient to purchase glucometer for self-assessment. Similarly, I should prescribe now peak flow meter to each and every my asthmatic patient. Now there are computerized lung function test or pulmonary function test that you should perform for every asthmatic patient to confirm your diagnosis of clinical bronchial asthma. In this lecture, maybe I can say the last point to discuss. I am just because there will be Ayurvedic management of bronchial asthma part 1 will be finished. There will be Ayurvedic management of bronchial asthma part 2. There will be Ayurvedic management of bronchial asthma part 3. Remember, minimum 3 lectures will be there. So end of this lecture is how holistic management of bronchial asthma. Holistic management of bronchial asthma, only we are writing points. This will be repeated every time. These 6 points will be repeated every time in every lecture. Of course, this my 6-step program, as now my students are knowing that Dr. Deshpande's style of treating any patient from cold to cancer is a 6-step plan. Anybody remembers that plan? What is the first step? Come on. What is the first step? Basuraj, loudly. Very rightly he said, Sankshepataha Kriyayogo Nidana Parivarjanam. Try to avoid causes as much as possible. Try to avoid the causes as much as possible. For example, till your immunity increases, if you are getting the allergy because of eggs, if you are getting the attack after eating the eggs, your asthmatic attack, don't eat eggs. So simple. If you are living in very, very crowded and air polluted area, if possible, change your house. Go to little bit more airy area, fresh area, if it is possible. So that's why I have mentioned the word, try to avoid the causes as much as possible. Maybe each cause may not be possible to remove. What is the second step? Basuraj? Pathya apathya. Second step. Pathya, that means do's. You do it. And apathya, don't do it. Do's and don'ts. Pathya apathya concept of Ayurveda is very important. You know what is pathya apathya in 3 regards. One is a food and another is a lifestyle. So you should tell what should be eaten and what should not be eaten. How should be his lifestyle and how should not be his lifestyle. So pathya apathya, do's and don'ts. Third, yes, if it is indicated, if your doshas, Vata, Pitta, Kapha, especially Kapha, lot and profuse cough, huge cough is there and it is trying to coming out. Late 2018, I tried to explain you the definition of bronchial asthma. Then Bija Dushti and allergy were there. Then I said that it is a Vata Prakop in Kapha organ. Then allergy may be because of the low immunity, and low immunity is because of the Rogaha Sarvepi Mandegno. Pathology was Srotas, Sanga and Vata Pratilom Gati. Treatment policy will be Agni, Deepan, Vatanuloman and Rasayana. Then we have seen what are the clinical features, what is the on examination, which are the investigations, and last was the 6-step program of Ayurvedic management. So I thank you very much for patience hearing, and I request all of you to please subscribe my YouTube channel. Thank you.